How do you recognize cystic fibrosis symptoms? Imagine trying to breathe through thick, sticky mucus or struggling to digest food properly. These are some of the signs that might point to cystic fibrosis, a genetic condition that affects many parts of the body. Cystic fibrosis mainly impacts the lungs and digestive system by causing the production of thick, sticky mucus that can clog airways and organs. Recognizing the symptoms early can make a big difference in managing the disease and improving quality of life. In the lungs, one of the most common signs is a persistent cough that may be dry or produce thick mucus. People with cystic fibrosis often have frequent lung infections like pneumonia or bronchitis because the mucus creates a perfect environment for bacteria to grow. You might notice wheezing or shortness of breath, especially during physical activity or when the lungs are inflamed. Some individuals experience recurring chest colds or sinus infections. Over time, the lung function can gradually decline, which might start in infancy but often worsens with age. Digestive symptoms are also key indicators. Because the thick mucus blocks pancreatic enzymes, fat digestion becomes inefficient, leading to greasy, foul-smelling stools that are often bulky. Babies with cystic fibrosis might have a condition called meconium ileus, where their first bowel movement is sticky and causes a bowel blockage. Children and adults may struggle to gain weight or grow normally despite having a good appetite. This poor growth is a sign of malnutrition, which can also cause a person to be shorter than expected for their age. Liver problems, such as jaundice or liver disease, can develop because of blocked bile ducts. Some people experience pancreatitis, which causes abdominal pain, and nutrient absorption issues that lead to deficiencies. Another notable sign is that the skin may taste salty, especially when parents kiss their children. This is because people with cystic fibrosis lose more salt in their sweat. Some individuals might also experience muscle or joint pain. In males, cystic fibrosis can cause reproductive issues, often leading to infertility because of blocked reproductive tracts. Since symptoms can vary widely from person to person and may not all be present at once, diagnosis can sometimes be delayed. Common diagnostic tests include newborn screening, sweat chloride tests, and genetic testing. If you notice any of these signs, especially if there is a family history of cystic fibrosis or recurrent respiratory and digestive problems, it is very important to consult a healthcare professional. Early diagnosis allows for better management and treatment options, helping those with cystic fibrosis lead healthier lives. Always seek personalized advice from medical experts to understand individual risks and treatment plans.